When we're looking at improving thoracic spine rotation here, typically what we tend to do is come and maybe twist our spine this direction, give a little bit of pressure. Maybe the spine pops and that kind of feels good. But what we can often do when we're doing this without awareness of the front side is we can start to compress our lower back by extending our spine back. So if you watch my back, when I twist and rotate this way, there's a lot of just kind of compression. You can see this valley in between my spine this way. And so what we want to focus on when, again, we're trying to focus on this thoracic spine is if you touch the front of your pelvic bones here and then your lower rib cage, we want to keep those aligned with each other. So typically what will happen is we'll let our lower ribs flare this way, and that's what adds that compression here. So if I lightly pull down, almost like I'm doing a little sit-up, and then rotate, I'm not going to go quite as far. So this is my true rotation, keeping that aligned. But then I'm getting a bigger stretch in my upper body. And so I can take a couple of breaths focused on my lungs. Focusing a little bit more on the bottom of the lungs, maybe the middle, the backside. And that will help stretch the inside of the ribs, getting the intercostal muscles, all the nerves and blood vessels in there, working on some lung mobility, diaphragm, and you're going to get a really, really good stretch in that side. So if you watch from the back, I'm going to line my rib cage and pelvis up and rotate, and you'll notice my lower back is a lot softer, a little bit less arched and compressed. And then I can take a couple of breaths and then go to the other side. And you'll notice instead of the cracking that you'll get with that quick rotation, you might actually get a nice cracking joint adjustment from those deeper breaths, which feels really, really awesome.